it's good to have you here. I think this is the first time me and you have just sat down.
Yeah,
for a good chat. So it's nice because obviously what we're going to talk about today is in your area where you work in. So it's me, Ty, as normal, and I've got Liam here. Liam, do you want to introduce yourself?
Yeah,
Tell us a bit about you.
Hi guys, Liam Canavan here, mainly working in the healthcare space in load balance for the past couple of years now. Last year's been really a focus on the medical imaging partnerships that we have, which has sort of got me right into the nitty gritty of the healthcare environment. Been really enjoying it. It's been quite a change over the past few years, but yeah, it's nice.
Yeah, it's been a couple of years, which has gone really, really well for you.
Yeah, past 2 years have flown by. It was like about 2 weeks ago I started here, so it's been a learning curve, not just to load balancers, but with the healthcare world as well. And obviously with everything changing in the healthcare world, we've been keeping up with that. A lot of my attention has been on the NHS and their sort of digital cloud plan as well. So it's been a lot of learning, and it's been interesting to find out how sort of the different problems are being solved in the healthcare world at the moment.
Okay, so tell me, how can load balancing specifically help enhance the patient experience? If I'm a healthcare provider, I'm thinking about, you approach me and stuff like that and want to talk to me about load balancing. I know the benefits, I work it as well, but how can we best get that across to them so they get a good understanding, high level?
Well, the thing about load balancing in a healthcare environment is that a lot of the applications run in sort of healthcare providers' environments are going to be mission critical. They're going to need to be up. Maybe they're going to be something like a medical imaging, like a PACS environment, or maybe it's going to be a virtual desktop environment. Yeah. What the load balancers do is they ensure that these applications have uptime. It ensures that there's a good flow between all the information, and it ensures that, for instance, radiology is a great example. One of the key things that interrupts radiologists is their workflow being interrupted. Okay, yeah. It might just be an image not loading, an image not being sent to the correct place, and that gives them a lot of trouble, because some of these radiologists have to look through hundreds of images a day, and they can be really critical injuries people are having. People could be waiting on surgeries. And as you can imagine, if the images aren't being sent or the application isn't running, it can cause quite a lot of trouble for the hospital in general, as the radiologist might not be able to give their analysis down to the surgeon. And it causes a backlog, and that's not good for patients, because obviously they're going to be waiting longer, and it's not good for the workers as well. So what the load balancer does is it actually performs sort of what we call health checks to ensure that these application servers which they're being run on are healthy. And that means that the applications are running smoothly the whole time, meaning that the doctors can do their work, so the patients can have a better sort of patient experience as they're not waiting for so long. So it's not really the load balancer that is the hero of the story itself. It just facilitates all of the applications that sort of obviously this healthcare.
I get you, because that's not something that, obviously I've been in hospital myself and been in a situation where I've had to go through appendix, and I was in a lot of pain. And the second time I went, it was for a twisted bowel. Both times I had to take x-rays, and it's not something that I really considered how it was actually working before I kind of moved to this sector to understand what PACS was and how that was actually working. But I definitely saw the fact is that they went in, did the radiographs or took the pictures of my body, and then 5 minutes later they're in scrubs and coming upstairs to take me into surgery. So having a good understanding that load balancing is helping that occur is definitely great for me, and definitely gives me a better insight into what's going on for these guys, because it is very important. Because like the clinician said at the time, when he came back to my bed, he goes, if you hadn't come into the hospital and you'd gone home to sleep, that would have been it. But just thinking about if he couldn't have got the information that he needed and the importance of that, what could have been the result? They could have sent me back home, given me more drugs, and delayed that from actually happening. So it's really good that we're helping patients. Maybe it's not something they see or realise, but it's definitely one for them to understand, really, that we are in there to help, and get that experience. And I'm definitely thankful.
Yeah, that's it. I mean, we work in so many different sectors, but in the healthcare world, sort of running of applications is obviously mission critical, because it can be life and death. We always say that's the most extreme example, but it is true. But also it can be smaller things like waiting times in hospitals, where a lot of people, especially in the UK, everyone knows, it's not a secret that in the NHS there's going to be long waiting times. And a lot of that can be attributed sometimes to sort of different parts of the hospital waiting on information to be shared between each other before they can move the patient to the next step. And again, it might not be someone that's needing a life or death surgery after a car crash, but say what the load balancer does, just ensure that workflow around the hospital, just to mean reduce waiting times, and just give a better experience in general.
So can that actually help reduce the cost? Because obviously they're spending less time, I guess.
Yeah, I mean, one of the main ways a load balancer can help reduce cost is actually to do with sort of, if you think of things like ransomware and sort of site down and things like that, it's not maybe the initial cost that's going to be saved, it's going to be what we call sort of disaster recovery is a great thing for a reason why you save costs with a load balancer. And a great example of that is say a ransomware comes in. What do you need to help stop that? Sort of what we say is immutable object storage, things like that, some certain solutions. While we don't actually provide those solutions, we facilitate those solutions. We enable the hospital to provide highly available immutable object storage, which then protects them from ransomware. We also provide the hospital with a sort of redundancy or a disaster recovery plan. One sort of example we like to use is, say, plane hits a building, their main sort of data center in the hospital goes down, or their server room goes down. And if you think that could be catastrophic in a hospital or a healthcare provider, that could be information lost, as we were discussing earlier, medical imaging, all those images could be lost. There's certainly no workflow going through, because if a plane hits the building. But what the load balancer does, and how this would reduce sort of the loss that would be enacted by sort of a huge server down, is it enables a disaster recovery, or a failover, like we call it, to another site. I mean, this can be in the cloud. This can be in another physical site. This could be another part of the hospital. And really what that does is it enables these sort of disastrous events that could really interrupt the workflows in hospital to be averted, which again is probably one of the key cost saving things, because as we know, some of these ransomware attacks can cost hospitals millions of pounds, large hospitals. And while we don't act as a sort of the key to stopping that, we help facilitate all the other applications and sort of disaster methods that mean when a hospital gets into a bad place, they can still operate as well.
Yeah, and that's the thing. Even with, talking about that, just with, beginning to talk about still being able to operate as a business. Obviously with the COVID situation where, they had a lot of staff working remotely, obviously it's helped them a lot there to be able to facilitate that as well. Where they could have been in a situation where staff were, safe to work at home, or they're off with COVID, but they can still work and they're still being able to do that. So that's definitely one of the great benefits, to be able to load balance stuff, especially the resources they got, whether it's a couple of web servers or to put information on, or it's a couple of remote desktop servers. I guess that helps them out a lot as well. So there's a lot to be done around that for hospitals, to make them more secure and to give them better ways of working, because we know that it does help with work-life balance for those staff, and less stress if they're able to work from home, obviously, with what they do. Obviously, surgeons, we really want them in the hospital as much as possible, but
we're not quite at that point of technology yet.
But I'm sure we'll get there, right? With
AI
and stuff like that,
coming along.
we will actually eventually get there. I'm sure, sort of like one day, we'll be on the hospital operating table, and there'll be a guy remotely, and he will operate on us.
That would certainly need to be load balanced and highly available as well. You wouldn't want that going down halfway through an operation.
Hey, I'm not saying I can't wait, but I can for that one, I think.
But just to touch on your point about the virtual desktops, and sort of maybe it might just be web servers. I mean, looking into the NHS last year, from my understanding, is there's a huge sort of disparity in the digital maturity. And you might have a small trust somewhere right in the sticks, you might have a large hospital somewhere right in the centre of London. And sort of what a load balancer facilitates is, as you said, it might just be a few web servers where people are booking their appointments, into one of these smaller trusts. But again, that needs to be highly available, as if you some of these smaller trusts serve a large amount of people, and they're sort of booking applications and making sure people can actually get to see their doctors is very essential out there as well. So it's not just about sort of the huge mission critical PACS environments. It's about day-to-day sort of healthcare facilitating sort of applications that enable staff all over the country, all over the world, to be able to see their patients and provide the healthcare.
And especially with patient stuff moving online now, it's a lot easier for them to be able to get to that data and information. And like you said earlier about the backups, I think that's like definitely something that hospitals definitely keen to do. And I think it's very, very useful to make sure that they're secure and immutable. So once they're written, they're written. You know? So hey, Liam, all I can say is thank you very much for coming along, mate. I really appreciate it. It's good to see you.
Yeah, it's good to see you as well. Happy to anytime.
Thank you, buddy.